Some of the things that you've mentioned point to some other things that go along with autism, seizures, GI issues. So sometimes that coordination of care can be really tricky. Thoughts about that? What works, what doesn't?
Just like Lori's Ethan, my Ethan didn't have a bowel movement for 18 days. I'm like, wow, that's a long time not to poop. But it's okay, I'm a mom, so I just say that word out loud. But so our pediatrician, I'm thinking I have to find my own specialist and figure things out. And we've had like 6 pediatricians, and a few are not on my favorite list right now. But she is on, and she's like, go here, do this, and do that. I mean, she is very knowledgeable. So even if you're not going to be a pediatrician, I think whatever specialty that you're going to go into, if you just kind of learn more about other things, I think every parent would really appreciate it. But she recommended, again, supposedly the best GI, and he doesn't work for Ohio State, I'm sorry. But, we're going to see him next week. She recommended what she said, it's the best neurologist, and he's wonderful. We have the same neurologist.
He's awesome.
But I think our previous pediatricians I think I would have to do the research most of the time. And which is fine. I mean, as a parent, we're supposed to do research, but I think we need that medical professional to kind of give us a little heads up or a little information so that we don't have to look through all the lists and just narrow it down for us already. But she gave us specific names to the cell number even, and it's really wonderful that she's that knowledgeable about other things, not just her specialty.
I think, and the most important thing to remember is knowledge is power. It is on your side. When you have understanding of what autism is, how it affects an individual, and what other areas that are affected by it, and how to target those areas when you're working with an individual, it's like somebody's giving you the brass ring. I mean, each child, each individual is different, and their needs may vary. But having that understanding when you're walking into a room or walking into whatever, to deal with a parent or an individual, just like she was saying about, not coming at me with these instruments. I mean, having that understanding ahead of time gives you, and why they don't like that, gives you more power in dealing with the situation.
Has it been tough to kind of pull all the pieces together for some of you in terms of different doctors, different healthcare?
Yeah, I've
experiences?
gone through 17 specialists, 17 doctors in Anna's almost 11 years of life. Just based on the fact who would listen to me, who wouldn't listen to me, their demeanor with her, and being able to work as a team. Because when you have autism, this spectrum disorder, this neurological developmental delay, underneath all of that is seizure disorder, sleep disorders, GI issues, pica, sensory integration disorder. And then there is different receptive learning, and it all falls under autism. So if you have autism, you have all these other different issues that go on. Not every single one has seizures, but a lot of them do. A lot of them don't sleep. A lot of them sleep too much. So it's trying to find like a happy medium. So I have a team of doctors that all know me and Anna and work together, because I go and see them every 6 months or every 3 months, based in my integrative pediatrician I see once a month. And as I've done all of this with her, with this team of doctors, you can see Anna has gotten better. I mean, working on all of the symptoms that she had, the seizures and the GI issues, the sensory issues, as those have gotten better, the autism has started to go away. Do you know what I mean? She's always gonna have autism, but she went from such severe autism to high functioning. And sometimes when someone is quote unquote nonverbal, severely autistic, they're really not, because they can communicate with you and tell you things by typing or things, and you see how really intelligent and smart they really are. But it's the way that we have to label it for the medical community and the community, is that when you start to feel better, the behaviors and things start to go away. Like if you don't sleep and you don't poop for 18 days and you can't talk, you're not nice. You're not nice. None of it, nobody in here would be nice. I mean, but if you
Right.
can't verbalize it, then the body starts to shut down, and it's seeing what needs to be done for each individual, and that we're not crazy. Sometimes you'll come in and you're like, this mom's nuts. And it's like, well, I haven't slept for 18 days either because my kid hasn't. So it's just seeing that little how far you should be able to go. And always work as a team with other doctors, especially if you know pairing up on different patients.
So what has worked in terms of getting your doctors, your healthcare team to work, to communicate and work together? What kind of strategies have you used?
I actually have not had any issues with my doctors. We even still see the same pediatrician that refused to take my concerns seriously, and I felt that was because I needed to educate him, and tell him, and he has since changed the way that he views things. He's told me straight up that when a family comes in, he's no more is he quick to say, I think you're, he's fine, or she's fine. He's more open to being like, maybe this child should be evaluated. He's even said that to me. And I respect that because we are all human. I don't think it was his mistake. I don't think it was anybody's mistake. I think it was just a matter of he didn't have a lot of knowledge on the issue. And that was my job to educate him. And then our GI doctor is through Children's, and he's great. And I had gotten his name from other parents, and I feel very comfortable with him. He listens. I think that's more than anything is them listening. I mean, really, truly hearing the parent, whether they agree or disagree with the parent, having the right approach to talk about why they're coming up with that decision with the parent. And maybe it's not necessarily while the kid is there, while they're all in the room together. Maybe it's at another time via phone or whatever the case may be. Because mom's usually not paying any attention anyways to anything that's going on, because we're thinking about 82 other things that we're going to have to do that day. So.